Hi, this is Felicia Bukisens. I'm coming to you as a registered nurse, as an educator, as a provider of community services through Jesus Reigns Restoration Ministry. Let us talk about clinical syndromes associated with COVID-19 so that when you have a patient, when you have a family member that is sick, you understand exactly what is going on. Information is power. There is about 6 syndromes that are associated with this disease. The first level, which is level 1, which is mild, is called mild illness. In this case, patients have uncomplicated, this according to the World Health Organization guidelines, patients have an uncomplicated upper respiratory tract viral infection, which may have non-specific symptoms such as fever. We already discussed that: fever, fatigue, cough, with or without sputum production. They don't feel like eating, poor appetite, they're tired, they feel weak, they have muscle pain, they have sore throat, they have a shortness of breath, either at rest without doing anything, or when they move, maybe they get up to go to the bathroom and things like that, or they get up to do something. They might have nasal congestion, as when you have a cold, or they have a headache. Rarely, patients may also represent with diarrhea. This is rare. Nausea and vomiting. This is in rare cases, but we cannot exclude that. For our patients who are elderly at this mild illness stage, or those who have their bodies, they already have other illnesses or other diseases that makes their immunity to be low, to be at a higher risk, they might have other symptoms that are not matching exactly this. For example, confusion. For our elder patients, you know, when an older patient has, for example, urinary tract infection, they present with confusion. You just see they are not themselves. Or somebody who is pregnant, right? They might have these shortness of breath, fever, stomach symptoms, fatigue, which may mix up with these COVID-19 symptoms. That's level 1. Level 2 is pneumonia. Just regular pneumonia, where an adult has a pneumonia but with no signs of severe pneumonia, which we'll talk about later soon. And there's no need for oxygen at this point. They are okay without oxygen. If it's a child that has non-severe pneumonia, you will see that they are coughing, they have less difficulty breathing or fast breathing, okay, in terms of the number of breaths per minute. If a baby is less than 2 months, breathing that's greater than 60. For 2 months to 11, maybe 3 months to 11 months, greater than or equal to 50. Like I said, less than 2 months, greater than or equal to 60 breaths per minute. 3 months to 11 months, greater than or equal to 50. 1 year to 5 years old, greater than or equal to 40. And no signs of severe pneumonia, just breathing symptoms. They are considered to be having pneumonia, not severe pneumonia yet. And then we're going to the third stage, which is severe pneumonia. If it's an adult or an adolescent, a young person, you will see fever here, or suspect a respiratory infection, plus the high breathing rate. Any breathing rate over 30 breaths per minute. So if you're a mother or you're a caregiver at home, you can count on your watch, right? Watch that has checking minutes, or a timer on your cell phone even. Or they're having severe respiratory distress. They're having trouble breathing basically, and the oxygen saturation using these devices is less than 93 on room air. If it's a child at this severe pneumonia level, it's a child with a cough, difficulty in breathing, plus at least one of the following. They have blueness to their color, oxygen saturation less than 90, severe respiratory distress, meaning they are grunting, severe chest indrawing. You see like a child has you can see a child is struggling. One of my children, when they were younger, they had this issue, so I can understand. Could be very distressing for a parent. Or the child can also have signs of pneumonia with a general danger sign, which is inability to breastfeed or drink. They have lethargy, they are weak, they're sleepy, or they're just unconscious. You cannot wake them up. Or worst case scenario, they are having convulsions, which is like seizure episodes. Or other signs of pneumonia may be present, like chest indrawing when they breathe, fast breathing based on breaths per minute, like I described before. Remember, for a baby less than 2 months, if breaths are equal or greater than 60, 3 months to 11 months, equal or greater than 50, 1 year old to 5 year old, greater than or equal to 40 breaths per minute. This is severe pneumonia stage. While the diagnosis is made on clinical grounds, chest x-ray may be needed at this point. We're going to level 4, which is acute respiratory distress, or ARDS, ARDS. Usually it begins 1 week of non-clinical symptoms or respiratory symptoms. You will see that the patient might need CAT scan, might need lung ultrasound, or even x-ray. Clinicians will know how to read this. And they will also know to differentiate. This patient has, for example, congestive heart failure. They may be able to differentiate between the two. There's levels of oxygen impairment in adults, right? I know I'm going technical right now, but just so you know where your patient, where your family member is. There is moderate, mild, moderate, severe, or when oxygen saturation is just not easy to get to, right? And for children, there are guidelines as well. Your clinician will guide you. This is acute respiratory distress, which is beyond irregular pneumonia, beyond severe pneumonia. And let me talk to you about the 2 last levels of which a patient really needs help in ICU. You will see if a patient has life-threatening organ dysfunction. Signs of dysfunction include change in mental status, confused, or they are too sleepy, difficult or fast breathing, low oxygen saturation, as we said before, less than 93. Usually less than 90 is more concerning. Reduced urine output. If a baby or an adult, they are not urinating as they should, right? It should be at least an average of 30 cc's an hour total. Well, you can tell. Let's say for 6 hours they've only urinated 100 cc's. That's concerning. Depending on their pattern, you will see how many wet diapers your baby has. Keep track of them as well. That's why another item to add on to your list to buy, see if you can buy a urinal, something to urinate in that has a measurement. For males, there's female urinals. If you have to get to that point, you want to be prepared for the time when you have to nurse your loved one at home, so it's not a waste of time or waste of resources. They are very inexpensive. You can get at any pharmacy. You can get them at any online medical supply store as well. At this level, somebody needs ICU care because their blood pressure will be dropping, their fingers, hands and feet and legs are cold, fast heart rate, weak pulse, you cannot even feel it very well, skin is turning color, labs will be changing because they are getting into acidosis and their body is going through stress and it's affecting them and they need more intense medical care. For a child greater than 2 years old, You will see this including abdominal temperature and white blood count above normal. Septic shock is when somebody, an adult, has persistently low blood pressure, requiring IV drips to support their blood pressure. Any blood pressure when the top number is below 100, is below, especially 95, below 100, and the MAP, which is the average, is below 65 or equal to 65, that's concerning. If you are checking your loved one's blood pressure at home and you see these numbers, it's an emergency. You need to call 911 and let the doctor know that we are going into the hospital. The same way for children. For children, either a child heart rate is too high or too low. An adult, if heart rate is below 60 and it's not their usual, this is why I always educate people who are taking blood pressure medications to record their blood pressure and heart rate so that they can know they are normal on average on a regular day. Check it in the morning, check it when they go to bed. But in this condition, when somebody is sick, check their blood pressure. If they are stable, check their blood pressure, heart rate, oxygenation, and temperature every 4 hours. It's reasonable. If they are very, very sick and you're waiting to maybe go to the hospital, you're waiting for 911, you're not sure, check them every hour. You know, that way doctors have numbers to use. So these are the 4 levels, that 6 levels of syndromes that come with this COVID-19 infection. And again, have on your list things to help prevent fever. Things like Tylenol is the best. For babies and adults, stock it up, have it in your house. You can order it online. Have some washcloths that you can do good old nursing, sponge with a warm, not too cold, warm sponge to absorb the fever. Okay, you can put it when it's warm. The patient is not, your loved one is not rejecting, oh, it feels uncomfortable. Warm, it can absorb the fever. You rinse it out, you wring it out, and you have a new one, right? Things to contain when they cough and sputum. Washcloth, tissue is the best because you can put it in a plastic bag, tie it up, dispose it. Flush in the toilet. When you flush the toilet, cover it. If they have to spit, have them spit in tissue is best. If you don't have enough tissue, we might get to a point, maybe we run out of tissue, spit in a cup, right? You go to the bathroom, you must wear your mask when you're handling these things. If you're taking care of somebody at home, throw it in the bathroom, flush, cover the bathroom when you flush it, right? Hygiene. Those, if they have to, you don't have tissue, you run out of tissue, and you cannot go outside. If we get to that point, God forbid, in your area, I'm not sure where you are, these clothes that they're coughing in, have several of them, soak them in a mix of bleach and soap, and let them be washed with hot water to disinfect them. So these are measures that we can use to take care of our loved ones, prepare as we go along. And on other videos, I'll talk on nursing care of someone if you have to take care of somebody at home, or when you are doing self-quarantine, what to do. Remember, it's just like regular flu. Fluids, warm water, hot water, if you don't like cold things, but fluid, give yourself fluid. Juices, orange juice, but water is the best. Orange juice. Some people do a mix of apple cider vinegar with honey. It works. It works for sore throat. It works for many things. I'm a nurse. I believe in the medicine. I believe in natural things as well. Vitamin C. Have them take vitamin C, 1,000 milligrams, 3 times a day. It doesn't hurt. It can only help them. Things to help you in this time. Soups. If they're able to keep anything down, soups, broths, things that are light to take. Make sure they can take their nutrition. I'm not sure about dairy products. if they're feeling nauseated, but make sure they eat something, a little something throughout, and monitor your baby. Pedialyte, it will help. But monitor your baby, make sure they are eating something, they are drinking something that has nutrients to help their body fight this disease. So thank you for listening, and I'll talk more about this in the upcoming videos. Again, thank you. This is Felicia, coming to you as a nurse, coming to you as an educator, and one of the clinicians at Jesus Reigns Restoration Ministry. Thank you. Take care.